We haven't found you a kidney yet, but I have some ideas.
I reacted to Scrubs for the first time a few weeks back, and I asked you guys to let me know in the comments what episode I needed to review next, and the majority of the vote was for the episode My Lunch. And if you know anything about Scrubs, their episodes are pretty zany. I'm excited to check it out. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please do me a favor and smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
Asking Dr. Cox to lunch. Hey, Dr. Cox, what are you doing for lunch?
As an ER doctor, we don't get any breaks for lunch, to go to the bathroom, nothing. We have either 8, 10, 12-hour, 24-hour shift. It just depends where you work, but there is no time allotted to take a break. It's just in between seeing patients.
Lunch for us, not going to happen. Normally I'd tell you something harsh right about now, like, we're not friends, but then you'll just grin that stupid grin and shake your head.
There are times when you have an attending, which is one of the doctors that you learn from, you're scared of, you don't want to talk to. It's a world of different personalities, so you just never know who you're gonna get.
Some doctors like to change into their streets when they go out for lunch. Not me. I like how the world reacts to me as a doctor.
Dear God, could this be any more of a nightmare?
Guys!
Yes, it could be more of a
no.
nightmare. Jill Tracy was a former patient.
Rule of thumb, I can speak for myself, there's a huge line that's patient-doctor relationship that never gets crossed, cannot get crossed.
Oh my God, what are you doing here? I was supposed to meet a guy for a date. I know what you're thinking, a Tuesday lunch date at the supermarket. He is so not into her. Well, guess what? He's not. I've been waiting for like an hour and just thinking, how many more guys from my yoga class can totally reject me without me just saying, enough, you know?
Oh, we have to get back to the hospital.
The same thing happens at the hospital. I see typically anywhere between 2 to 4 patients an hour. So unfortunately, you don't get to spend as much time with the patient. So if you're stuck in a room listening to a story for a little bit too long, it kind of impedes on the care.
We had 3 separate patients waiting for transplants, and we were doing everything we could to keep them alive while we could locate donors. There was Mrs. Sykes, who needed a new liver.
Livers typically don't happen just overnight. They progressively get worse to where then they stop functioning. You can have a liver failure that just, boom, happens super crazy fast. And getting a new liver obviously is difficult.
There was Mr. Dennison, who needed a new heart valve.
Most of the time a new heart valve is related to the aortic heart valve. There are other valves in a heart. You can actually get a prosthetic one. You can get a pig valve. You don't have to necessarily get a human one.
Then there was Dr. Cox's guy, Dave Bradford.
So now, Davey boy, I promise you, we're gonna find you a kidney.
And then kidneys. The kidney donor list is really long, unfortunately. You can survive without a kidney if you're on dialysis. If you can have a native kidney, that's much better.
We need to keep these people going until we can find donors.
Alrighty, Barbie, go check on Mrs. Sykes' ammonia level. She is encephalopathic.
Oh, there you go. Ammonia level encephalopathic. A high ammonia level is due to liver problems, and your ammonia builds up and gets to your brain basically and become confused, altered. We call that a type of metabolic encephalopathy, meaning confusion of the brain itself.
Gandhi, review Dennison's chart and get me a consent. Bobo, get on the horn to your cronies at local hospitals and get me a donor update.
So am I ever getting out of here?
We haven't found you a kidney yet.
You could be on the list for months, years. It all depends on the rarity of your blood and tissue, that sort of thing, timing, a lot of different factors.
But I have some ideas.
Oh my gosh.
Yeah.
Nice, a little black market kidney action. Yep.
I can live with 1 kidney.
Because we'll probably just go ahead and sell this one.
Oh no! Yes, no. Yep, you can't live without your kidneys. You need them, or need to be hooked up to a machine. Typically, you can live with 1 kidney. When you actually get a donor kidney, you don't take the other ones out. You just add in. The donor itself, you have to be matched with blood type, tissue type, all these different things to make sure that the donor kidney doesn't get rejected by the recipient.
Give me the update here.
You guy Bradford's electrolyte and fluid balance are stable.
Mr. Dennison isn't looking so good. He's on max inotropes and still in failure.
Mrs. Sykes is fully encephalopathic. Her ammonium level's through the roof. She's circling the drain.
Come on now, let's try to keep these people alive.
Oh my gosh. The kidney guy dealing with the electrolytes, the heart guy dealing with medications to optimize blood pressure and keep him from having like abnormal rhythms, and then the liver lady unfortunately becoming encephalopathic more and more. To treat the ammonia, we actually give medication called lactulose, which actually binds the ammonia. The way it gets out of the body is via poop.
She was admitted a short time ago and she hasn't regained consciousness.
Oh gosh.
Tox screen's positive for cocaine.
The tox screen shows cocaine only in her system. Tox screens don't test for everything. Tox screens test for like the main things. Cocaine, opiates, marijuana. Oh no!
Do you think she could have OD'd?
She had been stood up on a couple dates. And,
Oh no.
She hadn't seen her shrink in a while. She was definitely depressed.
So just so everybody knows, there are hotlines if you're feeling suicidal, depressed, that sort of thing you can call. Cocaine causes tachycardia, causes you to sweat, get palpitations, all that stuff. Typically, you're not gonna kind of be comatose. The only time you'd actually be comatose off of cocaine is like a rupture of a vessel in your brain and you basically are having a hemorrhagic stroke. Cocaine acutely shouldn't cause you to just be in a coma per se. There's gotta be something else going on.
I've got organs.
What? He's got his organs.
It probably means bad news for another.
Uh-huh. Sad. Sad.
You can use her organs.
Always difficulty having the conversation about body donation, giving the gift of life to somebody else by allowing them to survive their ailment by using, sadly, your loved one's organs. Such a hard decision because either the minute somebody passes away or shortly before that happens, the family members are literally, whoever's basically next of kin is getting questioned, hey, do you want to do this or not? Literally, this is such a hard conversation to have on both ends.
Is there anything anyone could have done?
No. No. In the emergency department, this happens to where we know that somebody's going to die, and sometimes the family makes that decision, and depending on the organ, it needs to be, it's a really messed up term, but like harvested appropriately, and so that way it's taken out at the right time. There are some things that can be donated just shortly after death. There are some that need to happen potentially while the patient might be still alive.
Perry, the autopsy just came in on your donor, Jill Tracy. She didn't die of an overdose.
Wow.
Good news for one person can mean bad news for another.
She died of rabies. Okay.
What?
All of our transplant patients are infected. We now know what we're dealing with here. Let's get involved. We can do this.
Oh no. What the heck is going on? Wait a minute. So you would assume that somebody who is healthy, that their organs are healthy, right? You don't typically test an organ per se. You're testing the blood levels of the organ to make sure that they're functioning appropriately. So because rabies is so rare, it's not typically something that's really tested in organ tissue or in the bloodstream for transplants. There is always some sort of risk, and this is just unfortunately a bad situation.
We did all we could over the next few days to keep the transplant patients going, but odds were against us. First, we lost Mrs. Sykes.
What? I just wanted to make a point of like when actually somebody does pass away, you do turn off the monitors and you take off the oxygen, and the body does lay there for a little while depending if the family is around or not, and then you call the next of kin and let them know, and sometimes they want to see the patient in the hospital bed where they're at before they're moved to the morgue of the hospital.
Hey, hungry? Guess that lunch was kind of a one-time thing, huh?
I know this feeling. Sucks.
There's no way you could have seen that coming. I mean, rabies? Those people were gonna die in a number of hours and you had to make a call.
Yep.
I would have made the same call. Yeah. Yes. Now I got us lunch, and I think we should eat it.
Woo! Okay, that last section is like really intense, and in the sense that you are busting your butt with all the training and all the experience that you have to save people's lives and to do everything possible for them. Nobody cares about the glory, the paycheck. Our job as physicians is to help people. Having a colleague then come talk to you about it. It helps you move on so that way you can be the best doctor and the best human being for the next case and for that next patient. That was really intense. There's so much that we can dissect and learn from the TV show Scrubs, and as I said before, it's like the most accurate to what residency is like and how hospitals are kind of run. If you like this video, I think you're also gonna like this one. So check it out, and as always, thank you so much for watching and stay healthy, my friends.